Hi, this is Emily D'Ambrosio. Before I start my presentation for the nursing informatics class from Purdue Northwest University, I did want to go into the definition of nursing informatics, which is the specialty that integrates nursing science with multiple information management and analytical sciences to identify, define, manage, and communicate data, information, knowledge, and wisdom in the nursing practice. And this is from the ANA, cited in 2015. So through my picture, I gave some examples like the EHR, the internet in general, wireless EKG monitoring to obtain data, various devices such as electronic communication and data, which is beneficial in collecting data in general for the patient, just through various ways involving electronics in general. So for my idea of and my proposal, I wanted to show how Bluetooth could be beneficial in the hospital setting for monitoring vital signs. So we'll start off with my presentation picture from my original poster that I made. Basically, I wanted to give an introduction of the overall goals and ideas and then give an examples. I have 3 different examples. So, as I said, monitoring vital signs in the hospital setting requires wires to obtain basic vital signs, so pulse, blood pressure, temperature, etc. But I found that there's been several issues in the hospital setting that could be easily resolved using newer technology. In my hospital unit, we utilize wireless EKGs, so why could we not utilize wireless vital sign monitoring through Bluetooth? I would hope that this would decrease patient falls, improve patient satisfaction by decreasing the disruption of sleep, and also decrease nurse stress when someone has an infectious disease such as COVID-19. These examples are demonstrated in my next following 2 videos and drawing. Hi, I'm here to take your vital signs. Is that okay?
What is going on? What time is it?
It's like 1 or 2 in the morning, but that's what
What
the
are
order
you doing in my
says.
room at 1 in the morning?
I have no idea, but that's the order.
Ah, okay.
Hi, Mr. Wan. I'm here to take you to the bathroom, okay?
Okay.
But you have all these cords on you for your pulse ox and your blood pressure. Let me move all this out of the way because I feel like you could really fall with all this clutter. Okay?
Okay.
And let me go get some extra assistance. So, beyond COVID-19, there are other issues and other examples of infectious diseases such as Ebola or C. diff even, which requires a lot of gowning up, which I drew in my picture as an example of goggles, gloves, masks, and so on top of the fear nurses may experience having to go in and monitor vital signs excessively. If this could be done using Bluetooth technology, which is very accessible and easy to use, routine vital signs or continuous vital signs could be taken without the nurse having to gown up. So, through an article written by Joseph et al. In 2018, there were several ideas of goals which I did demonstrate through my video recordings and also through my drawing of infectious diseases and decreased exposure. And those also included preventing falls and decreasing patient interruptions. And this article focused on how Bluetooth devices for monitoring vital signs, that was the main goal of the patients and the nurses. Both of those to decrease clutter, prevent falls, and also patient interruptions, as in not waking them up throughout the night during sleep and instead just clicking a button and having that pop up wirelessly onto a monitor, similar to how In my unit, we use continuous EKGs, so we can see the pulse and the rhythm they have instead of having to go in and manually set up a 12-lead EKG, which is unrealistic. Again, why not utilize that similar technology to get something like a blood pressure instead of interrupting them in sleep? Just press a button and obtain it. And then that data could be translated and transcribed to certain devices, such as the computer, and then recorded from there and so on. So, focusing on the accuracy and outcomes. Various accuracy and outcomes were recorded through different studies. So, for example, an article written by Nantum et al. In 2022 focused on how accurate wireless Bluetooth devices were, and basically from there found that they were pretty much within the adequate needs of like being acceptable, as in respiration levels, pulse, blood pressure did not really differ significantly when compared to being taken through a manual or cordless device. Also, Leanan et al., through his article in 2020, did state that wearable wireless continuous monitoring devices are mostly still in the clinical validation and feasible testing phases, which is important to note that more needs to be done to ensure the accuracy. However, because of the other studies found, it seems to have a positive light. And overall, I think it would be very beneficial in the healthcare system to reduce many unnecessary contacts with infectious disease, decrease clutter and patient fall, as I said before, and improve patient satisfaction with less sleep disruption. Overall, this is the wrap up of my presentation. I did want to include some of the devices currently being utilized. At the top, you could see a monitor and a wireless cord that has pulse ox attached to it, so decrease in wires. Instead of taking oral or temporal temperatures, you have a little band that would go on the forehead to monitor temperatures continuously, and below is just a picture of the data obtained, so respirations, pulse ox, and so forth. I do want to recognize the importance of nursing informatics and the nursing culture, and how technology is always developing and adapting, and that using Bluetooth to monitor vital signs wirelessly can really be beneficial in the nursing and clinical setting. All right, thanks for watching.